All right, welcome everyone. We are here today, January, or not January, gosh, what month is it? It's July 8th, 2025, for a technical webinar, How to Become a Certified Application Counselor. And we wanted to bring this forward to you all, knowing that there is a lot of change happening. There's a lot of change happening in terms of our navigator funding, in terms of our enrollment landscape, and we want to make sure that we have as much capacity as possible in our communities to serve our consumers across Wisconsin get the coverage that they need. And so we found that this was the right time to reprise this overview of how people and organizations can become certified to become uh, an application counselor and a certified designated organization. And so I have a really fantastic colleague with me today, Elizabeth Rothy, who will help us provide this technical training. I am Caroline Gomez Tom. I'm the Enrollment Network and Accessibility Manager with Covering Wisconsin, and I will be our moderator for today and will be overviewing the questions that come through either the chat or later on, we will have you guys raise your hands if you'd like to ask a voice question. But ultimately, this session is for you all to really understand and know what the next steps are for you to become a certified application counselor. So we're with Covering Wisconsin. So if you're not familiar with us, even though I know many of you are, we're a program that is grant and contract funded at UW-Madison Division of Extension, where we help people in Wisconsin find and use health insurance. Many of you are familiar or have been involved with our Navigator program. We've been a Navigator entity for the state of Wisconsin since 2014, where we've received funding from the Centers for Medicare and Medicaid Services under the Health and Human Services Department nationally to help people uh, enroll in coverage, usually through Medicaid or the health insurance marketplace, healthcare.gov. And then we also provide education, outreach, and promotion similar to the trainings that we're providing today. And we also make health literacy materials that are consumer tested and written in plain language. And so why are we providing this training today? As I mentioned, CMS has announced that there is going to be a 90% cut in Navigator funding beginning in August of this year. And there's been funding changes that limit the essentially capacity that we've had over these last few years in providing enrollment assistance through this Navigator network. And so it is more important than ever to reinvigorate the importance of certified application counselors and expanding that capacity wherever we can across the state to hopefully try to meet some of the needs and maybe potential gaps that we will be losing with our Navigator program shrinking. And I just wanted to say one more thing on that slide. Um, as you can see, over these last several years, we've been able to increase the number of people enrolled in the marketplace. And of course, many of you were participating in helping people maintain their Medicaid coverage and, if needed, transition to the health insurance marketplace. And we hit a milestone over the last year in 2024. And so it's important that we continue to build this enrollment assister capacity to maintain the strides that we've seen, because we know that coverage is really just the window to people's care and wellness, and we don't want to lose kind of this momentum that we've gained over the last couple of years. Next slide, please. All right, and so here I'm going to pass it over to my wonderful colleague Elizabeth as she goes over what we're going to talk with you today, and we'll get into the presentation.
All right, thank you, Caroline. Thank you everyone for joining. Today we are covering the types of assisters in Wisconsin. what a certified designated or CDO organization is, who can apply and who cannot apply to become a CDO, the privacy and security requirements and federal and state requirements for CDOs, the federal and state requirements for certified application counselors, also known as CACs, those transitioning from Navigator to CAC, the timeline for CDO applications and fulfilling requirements, as well as other resources that we have available. The types of assisters in Wisconsin are navigators, which, as Caroline mentioned, are funded through grants from CMS, or the Centers for Medicare and Medicaid Services. We also have certified application counselors, agents, brokers, elder care benefits specialists, usually at the Aging and Disability Resource Center, public enrollment assistants, so that could be individuals who are helping consumers apply for Medicaid, and financial counselors. For a brief beginning overview, if a person would like to provide Medicaid and marketplace enrollment assistance as a certified application counselor, then they must first be connected to an agency that is approved as a certified designated organization. If an organization is not interested in being a certified designated organization, please know that you can still provide Medicaid application enrollment, even though you will not be able to be certified as an application counselor to provide marketplace and Medicaid enrollment. So you can still do Medicaid applications with consumers that you're seeing. So what is a certified designated organization? CDOs are contracted with CMS, or the Centers for Medicare and Medicaid Services, and they authorize and certify employees and volunteers as certified application counselors. There is no funding from CMS for a CDO contract agreement, but there is also no direct cost to become a CDO. So there is no application fee in order to be able to become a certified designated organization. Who can apply to be a CDO and who cannot? There are many organizations that are eligible to apply as a CDO. They must attest that they protect personally identifiable information for their consumers, also known as PII. They do not have any conflicts of interest. They help people serve with health coverage issues, have experience providing social services to their communities, and will make sure CACs complete required training and comply with privacy and security laws. A few examples of organizations who can apply to be a CDO are healthcare providers, such as community health centers and health systems, and behavioral and mental health clinics. Community-based organizations, including libraries, WIC programs, and food pantries could also apply, and government entities such as the Aging and Disability Resource Center. Those who cannot apply to be a CDO are the organizations that are unwilling to follow federal and state requirements, health insurance issuers or qualified health plans, agents, brokers, or organizations who receive funds from health insurance issuers for enrolling people into coverage. For example, if a health issuer is supplying funds to the organization so that a CAC is enrolling a consumer in their coverage, that would be a conflict of interest and they would not be able to be a certified designated organization. Also, organizations within a state that do not operate through the federally facilitated marketplace. Wisconsin does operate through the federally facilitated marketplace. So if you are in Wisconsin, that should not be a problem. For example, Minnesota has a state-based organization, so they do not have contracts with CMS to be a certified designated organization. Does anyone have any questions so far before we move on?
And we can have you either raise your hand, or you can also put your questions in the chat, and we'll try to address them as we go along the presentation.
Absolutely.
All right, none at this time, so I think we can continue. Thanks, Elizabeth.
Perfect. So for privacy and security requirements for certified designated organizations is to keep consumers' personally identifiable information secured, provide privacy notice statements, either on your website and to the consumers, obtaining informed consent before receiving consumers' personal identifiable information, screening the CACs for any conflicts of interest, and to report incidents and security breaches to CMS. Personally identifiable information is information that can be used to distinguish or trace an individual's identity, whether it is alone or combined with other personal or identifying information. A few examples of personally identifiable information could be someone's full name, their social security number, their mother's maiden name, and their date and place of birth. This list is not an exhaustive list. There's a lot of information that can be linked together that could be considered personally identifiable information. PII is typically collected so that a CAC can provide detailed enrollment coverage assistance for Marketplace and Medicaid for a consumer. CDOs and CACs, as I mentioned, are required to protect this consumer PII. They must also develop, maintain, and update privacy and security protocols and remain vigilant in their efforts to protect their consumers' PII. CACs can provide limited assistance and guidance if the consumer does not consent to sharing their information. So if a consumer is not interested in sharing their personal information with you, you can still guide them to different places that may be able to help.
And I'll just share, Elizabeth, one example that we commonly see in that circumstances. For example, if someone calls us to set up an appointment, they may start talking to us and providing some information just generally about their current situation. And we are able to take some of that information in order to make them an appointment. But once they start getting into like the technical details of their individual case, where they're, giving us information about their household and income and things like that, that's where we have to kind of pause and make sure that we let them know that once they are in their appointment, one of our navigators will go through the consent process to make sure that they can accept some of that that PII.
Yes, perfect. Thank you, Caroline. There are also some organizations like federally qualified health centers that are required to protect their patients' information and public health information through HIPAA guidelines. CACs that are following HIPAA requirements will already be abiding by CMS's requirements for keeping PII secure.
So long story is that we want folks who are already taking care of people's information through HIPAA, knowing that you already kind of have a head start in the process of becoming a CAC because you're already doing what's needed to take care of folks' information. So hoping that that encourages some folks to consider this process.
All right, the federal and state requirements for certified designated organizations are screening their CACs, again, to ensure they protect PII and do not have any conflicts of interest. You'll notice that we've talked about this already multiple times because it is so important. They must have experience providing social services to their communities, maintain an up-to-date CAC roster with CMS and the Wisconsin Office of the Commissioner of Insurance, or OCI, and assigning unique CAC IDs to their employees and volunteers. They must attest that the CACs complete required training, comply with all privacy and security laws, and meet other program standards. They will renew their CDO status every 2 years and register with OCI using the non-navigator business entity registration. And we have a guide that we will be sending out that goes over this information more in depth. But as always, if you have questions about anything in particular, please just let us know. And then the application process to become a CDO is to determine who your organization's senior official is. So this is someone who can bind your organization in a contractual agreement, and they will read, sign, initial, and attest to the terms of the conflict of interest attestation form. When submitting the application, you need to submit it in one go. You can't get up and make any changes. Nothing will be saved. So as long as you are collecting all of the necessary information before you start the process, it should be a pretty smooth experience for that application. The information that's required for applying is the organization's senior official contact information, the CAC project director contact information, and this is the person who is overseeing the CACs or the CAC program within your organization. And if someone is going to be helping with the CAC roster, a secondary contact can be provided. You'll also need to provide the organization's name, the federal employee identification number, if applicable, a previous CDO ID. So if you were a CDO previously and you didn't renew and you may have had an expiration of your contract, you can still reapply. You would just need to provide your previous CDO's identification number. You'll also provide the organization's phone number, email address, website, the headquarters address, a list of state and counties where the organizations will operate, your primary organization type, which could be a hospital or social service or government entity, the organization's specialty, if it's applicable. So if you work with tribal organizations or faith-based organizations, you would put that under the organization specialty, and your intended enrollment assistance type. So this is going to define if you are providing enrollment assistance only during open enrollment or all year round. After completing the application, the CMS CDO program office reviews the application and sends a status email within 2 weeks. However, if you do not receive this status email, you can contact them with your application's ID number. If you are preliminarily approved, your organization's senior official will receive a DocuSign, which will officially submit the agreement. CMS will once again review the signed agreement for final approval and sends a welcome packet with your CDO ID, a link to the organization maintenance web form, and instruction with next steps. The organization's leadership can then assign CAC IDs so the prospective CACs can begin their training. Once the approval has come from CMS, you will need to report to OCI to set up your My Wisconsin ID, register using the non-navigator business entity registration, provide a list of all of the CACs that you employ, supervise, or are volunteers. And on a monthly basis, if anything happens to your CAC roster, you will provide an update. So if a CAC leaves your organization, you would provide this update. Or if a new CAC joins your organization, you would also update OCI every month. Assigning a CAC ID is done through the organizational maintenance web form. And we have an example on this slide. The first 8 character digits are your CDO ID. And that is so CMS knows that the CAC is with your particular CDO. You will use the CDO ID and then add 5 or more numbers to the end so that the CAC has a particular CAC number. You will always use the person's full legal name, and this will avoid issues with CMS's verification process. Even if you have worked with someone for a long time, you may not know their full legal name. So I would recommend asking what their full legal name is and if they have a preferred name or nickname that you can add to this roster as well. So there are some training requirements for new CACs, and they are both federal and state. You need to complete 16 pre-licensing credits of accident and health education. These 16 pre-licensing credits can be completed by attending Covering Wisconsin's annual enrollment conference, which is this year, September 3rd through the 5th and 8th through the 10th from 8:30 a.m. to 12 p.m. And this registration will be coming out in the next couple of weeks. You will complete the federal training, pass the state licensing exam, which is provided by the vendor named PSI, and complete a conflict of interest report with your CDO. As I mentioned before, the guidance for this is more in depth that will be coming out. It will show you how to log into the federal training, how to schedule your exam, and other items about pre-licensing. Navigators who are transitioning to a CAC will receive a CAC ID from their certified designated organization and complete the federal training. You will always use your existing login, and you should not create a new account for your federal training. This includes CACs that were CACs, let's say 4 years ago, left, have not been a CAC, and then are coming back becoming CACs. You will log in either with your old information or get a hold of the help desk, and they can help you reset the portal. If you create a new account, there will be a problem with the Experian verification, and you won't be able to get into the training. Navigators who are transitioning will be able to complete their 8 continuing education credits by attending the annual enrollment conference from September 8th through the 10th. Navigators do not need to retake the PSI exam, but they will complete the conflict of interest report with their organization. For the timeline overview, organizations can apply to become a CDO any time of the year. If your organization is interested in providing enrollment assistance for healthcare.gov open enrollment this year, we recommend that the application and training is finished as early as possible. As I mentioned, the pre-licensing and continuing education credits are available during our enrollment conference, and the federal training is usually updated for the 2026 plan year and available in early September. However, you can still train CACs a little bit early, and if you have any questions on that, please just let me know and I can provide some guidance. My email is in at the end of the slide deck, so please feel free to reach out. For more visual timeline overview, we have July, which is when you can apply for a CDO with CMS. You will read and sign the contract agreement in DocuSign, and they will let you know if your application is approved. In August, you can submit your CDO updates to OCI, ensure that your privacy and security requirements are in place, and update your CAC roster and assign CAC IDs. In September, they can complete federal and state training requirements, pass the state licensing exam to become CACs. The CDOs will update their CAC roster with OCI after that has happened, and the federal training completions are automatically updated within the federal CDO portal. And then once everything has been done, CACs can begin assisting consumers. There are ongoing reporting requirements for CDOs. However, there aren't that many. The initial process for becoming a CDO is really the heavy lift and getting the training for CACs finished, also a heavy lift. But once that happens, there is only a couple of reporting that you need to do, which is the monthly reporting for any changes within the CAC roster, yearly changes, which is where you report that CACs have completed their annual federal and state required training, and a 2-year reporting requirement, which is when you renew your CDO contract with CMS.
I know that'll be a welcome change for some of our Navigator partners, knowing that they had to submit a weekly report every week.
Yes, yes, that is very true. So there are a few ways that consumers can find you. Covering Wisconsin hosts a scheduling portal called the Connector Tool, and this allows CACs and other assisters to post their contact information and even an appointment schedule. Consumers can access the Connector Tool through wiscovered.com and coveringwi.org. And we are more than happy to provide trainings and information on how to use this tool. You can create, manage, and complete consumer appointments. I know for myself, I like being able to schedule appointments online without having to call people. This is a nice way for me to be able to make an appointment if I needed to. So I know that having multiple ways for people to be able to find you is really great. There is also Find Local Help, which is on healthcare.gov, which we provide information on as well. Caroline, is there anything on the Connector Tool that you want to add?
Yeah, and one thing that I will share is that this resource is covered, the cost is covered by Covering Wisconsin, and we make it open to all of our partners who have gone through our essentially our vetting process, and that includes agents and brokers, as well as certified application counselors, and then of course navigators. The one big requirement before we can put anyone on the connector tool is that they are open to the public. So as you are determining whether you're going to be a certified designated organization and certified application counselor, your organization may choose to only serve your patients or serve, a part of your community and not be open to the public, and that is absolutely okay. We just may not be able to include you in the connector tool because we want to make sure that folks that end up at the connector tool can find someone that's near them that will make sure that they'll take their appointment.
Perfect, thank you. So some resources that we'll be providing in this slide deck, we have the CDO overview that is hosted through the CMS website. The Find Local Help tool, which I had mentioned before, is where consumers can find you on healthcare.gov, as well as the user guide will be linked. And the other step-by-step guides will be emailed out after the webinar. A survey evaluation will also be put in the email. So if you could provide feedback regarding this presentation, what you liked, what I can improve, I would really appreciate it. And like I said, that will be in the email that comes out after this webinar. And any questions?
Yes, please. If there's any questions on kind of this run through of the becoming a CAC process, we are open to that discussion.
Yeah, I have a question. This is Ryan over at Partnership
Sure,
Community Health
Ryan.
Center. Not sure if you've come across this yet. So what we're doing is, so we're already a CDO, so we're going to transition our two navigators back from navigators to CACs. I went into the CDO like maintenance portal to re-add them into our roster, and it's giving me some problems saying that they already exist in the system and that um, you know that I need to assign them like a new CAC number. I already put in a email request with the help desk over there, but I'm not sure if you had come across that yet.
Yeah, so sometimes if someone has been a CAC, but they don't have the CAC clicked in their federal training because they transitioned to a navigator, it will cause them to be expired or decertified. And so
Yep.
they may need either a new ID assigned, and when you assign that ID, you would put in their old CAC ID underneath it. That's how it's supposed to work. But of course, that's not always how it does work.
Okay, so yeah, there's a section for the old CAC number, but then I would have to assign them a new one as well.
Yes, yep, because
Okay.
they would be considered expired from taking the CAC training within the last year.
Okay. Thank
All right.
you.
Thank you, Ryan. All right. And then, Elizabeth, we got a question in the chat from Rebecca Walke. Is there a cost for the exam for CACs?
Great question. There is a cost for the exam. It is $75. And most people take it more than one time. So there is that cost. It can be taken online. It can be taken in person. We do recommend that you take it in person. They are very restricted on the things that are allowable for taking the exam online to make sure that you're not cheating. And that does include making sure there's nothing running in the background. So if you have a laptop or computer from work, it's very difficult to get anything to stop running in the background due to different protocols at different organizations. So doing that online, that would be something that they would say, sorry, you can't take it. So if you can do it in person, that would be ideal. And you would need your pre-licensing certificate and a valid ID in order to take that exam.
Rebecca says, thank you.
Yes, of course. Thank you for asking.
All right, we have another question from Lynette Bird. Once an individual receives a CAC ID, does the ID need to be renewed annually? Or as long as you are practicing CAC, then the ID does not term?
Great question. So as you are practicing as a CHC, you will do the annual federal and state training. So you will do your 8 continuing education for the state and the federal training every year in September. And as long as you are doing those two things, you will not lose your CAC ID. You will have the same CAC ID as long as you complete those two requirements moving forward.
And as long as your certified designated organization renews their status as
Yes,
well
good point. That is a
every
good
2
point.
years.
Yes.
And then I see Francisco's hand up.
Yeah, and on the same topic, like because as the CAC, you have to do like 8 hours of webinar. The conference will count as that, right? So you
Yes.
do the conference or you take the 8 webinars. It's one or the other, right?
Yes. So there are online webinars that you can take through different proctors that are usually out of state, actually from Wisconsin. So you could take those online. Those do have a fee. And then we do offer the enrollment conference every year, at least so far. And again, we are doing it this year. And that will have the 8 continuing education credits from September 8th to the 10th.
Excellent. We have another question from Margaret Winter. I'm a licensed insurance agent. Is it sensible for myself or my organization to become CAC certified?
That is a great question. So, agents and brokers that receive funds from qualified health plans or issuers are not eligible to be a CAC. So, if you are receiving direct funds for enrolling people or getting donations from qualified health plans to fund enrollment assistance, that would be a conflict of interest according to CMS and would make you ineligible to be a CDO.
And she said, thank you.
Of course.
All right. So right now I'm not seeing any other questions. I'll give it another minute in case someone is typing feverishly, or
Yeah.
if there's hands that want to go up and if someone wants to voice their question.
It is a lot of information at once. So, as I mentioned, please feel free to email when you think of something.
Absolutely. And also when you're going through the process, you may have questions at that time, because of course we can talk through the process and what it looks like, but once you're actually actively doing it, then the questions can just flood in.
Yes,
So
and this is a very high level overview. We didn't even the high level overview is a lot of information. I didn't want to get too into the weeds, neither did Caroline. So yes, I totally agree, Caroline.
wonderful. All right, so it looks like we have a couple more questions. So Julia, I see and recognize you.
Hi, everybody. So there is a pathway to get somebody certified before open enrollment this year by attending the conference. Or if someone was super hot to trot to do it like this summer, they could reach out to you, Elizabeth, and they would probably be directed to view and attest last year's conference slides.
Yes.
And can they still, before the go dark period, complete that MLMS training? Do you have a sense of when that go dark period is? There will be a natural inability, this gap to move, to do anything, because you'll be barred from doing 2025 training, but you won't have access to 2026 yet.
Yes. It usually goes dark mid-August. So if it were me, I would submit my organization, or if I already have a CDO, I would assign my CACs and do the federal first. And then that is about 12, I believe, modules with tests on them. And then reach out to me so that I can get you the 16 hours of video from last year's conference. And then we could get moving forward with the PSI exam right away.
Wonderful. Thanks, Elizabeth. We also have a question from, and I'm sorry if I say this incorrectly, Nanash?
It's
Nanash?
Nanash. Thank you, Caroline. Hi, everyone. My question is, I recently received information suggestion that the CAC exam can be retaken multiple times, provided that the associated $75 fee is paid for each attempt. Could you clarify whether this is accurate?
That is accurate. From my understanding from OCI, it can be taken multiple times, but it is $75 per attempt.
Okay, thank you.
Of course.
And I'll also mention, because we've helped kind of coach different organizations with some of their team members that have needed to take the test a couple times, whether it's even some of our navigator partners or certified application counselor associated organizations. Sometimes people are nervous to take the exam, and that's actually one of the reasons why they end up just coming a point or two under the required grade, which, Elizabeth, do you know the approved grade off the top of your head? Like what,
I want to say it's 28, but I could be mistaken.
like 28
Like
questions,
28
correct?
out of 35.
Okay.
There's 35 questions.
Okay. And so sometimes people will hold off from taking it again because they feel like they need to like study more. But the reality is that sometimes if people just take it shortly after they take it that first time and they realize that they just had to shake out the nerves, they end up scoring that 1 or 2 points more that they need to pass. So I do recommend that approach in most cases. Obviously, you know, if someone just didn't study and was not prepared, that might be a different circumstance. But most of the time, it's nerves that get that person like right under the limit. So I want to go to the chat. There's a question, is there a cost for an organization to become a CDO?
There is not a cost for an organization to become a CDO. There is no application cost. So you can submit the application free of charge. It would just be, what's already covered with salaries and those kinds of fringe items, but no direct cost for CDOs.
Excellent. And then I see Julia, you have another question, my dear?
I do. Can we say a little bit more about not having to be a certified application counselor to assist people to apply for Badger Care on Access, and the value of maybe dabbling in that now to just get your feet wet in the world?
Yeah, absolutely. I might actually go to Caroline for this one.
Sure. I'm happy to answer that. And that's a great question, Julia, and a great comment. So it's true that you do not need to be a certified application counselor or a navigator, or to have any type of certification to provide enrollment assistance with Medicaid. It's one of those applications that is allowed for anyone, any organization, any family member or individual to help someone go through that process. Of course, at Covering Wisconsin, we always recommend that if you are able to participate in our trainings and in our conference, even if you're not certified, because that gives you at least some guidance and information about how to help that individual through those different processes. But Medicaid there's no requirement. And so a good way to get your feet wet is if you know someone or you're helping community members with other program needs and you find out that they need access to health insurance and they may or may not be eligible for Medicaid, you can go through that process. I say may or may not, it's because as an enrollment assister, we do not determine eligibility. We only can fill out those applications and it will be the state of Wisconsin that determines eligibility for Medicaid. So our best bet is to help them apply, and then see what the results are and help them through that process. All right. These are wonderful questions, and I really do appreciate the interactive discussion. I am currently not seeing any other questions. We'll do the whole minute while I talk and give us some airspace while maybe people are typing or people are gaining the courage to raise their hand. And then we'll see if we have any other questions. But if not, that is okay as well. And we will accept your questions via email if they come to you at a later point in time or when you are going through the CDO and CAC process, because we hope that all, if not many of you, are considering doing that. All right. Well, I think with that, we will say goodbye, but not forever. And and we hope that you all have wonderful rests of your days. And please feel free to reach out to us. We'll have a follow-up information or email with the evaluation link. Please complete that because that allows us to do a better job at these webinars. And then there'll be a number of resources also in that email. So thank you so much for your time and have a great rest of your day.
Thank you.
Thank you, everyone.
Thank you so much.
Take care, everyone.